big bridge in my country, about 6.25 kilometers, which is having a huge communication in the different districts of my country. Now, the abstract of my titles. The background. Coronary heart disease remains the major cause of mortality and morbidity in the entire world population, despite therapeutic advances that control many risk factors. Lipid profile is regarded as an important factor in the development of coronary heart disease. There have been numerous studies confirming the association of dyslipidemia with coronary heart disease in most of the Western world and as well as Asian countries of the world. But we do have little data on the relation between coronary heart disease and lipid profile. The aim of my study. The aim of this study was to assess abnormal lipid levels and their association with the coronary heart disease. Can you hear me? Hello?
I can hear you very clearly. Go ahead.
Okay. The method. Yeah. Comparative observational study was conducted at the Department of Cardiology in M.Abdur Medical College, Dinajpur, Bangladesh, from January 2019 to December 2019. Properly written consent was taken from all the participants before starting the main part of the investigations. Obeying the inclusion and exclusion criteria of the study, a total 131 participants were finalized as the study population. Among the case group formed with 90 patients who had coronary heart disease and with 41 healthy people, control group was formed. All the necessary data was collected, analyzed, and disseminated by several programs of MS Office Word and SPSS version 23. The result. The study was conducted with 90 case group participants and 41 control group participants. Among the case group, 78% were male and 22% were female. The study showed serum total cholesterol and HDL cholesterol concentration were significant in all the age groups, and the p-value was less than 0.0001 in every age group. Whereas triglyceride concentration was significant between case and control group in 41 to 50 years and 51 to 60 years age group with a p-value less than 0.001. But in the age group more than 60 years, we didn't find any significant correlation, and the p-value was 0.478. LDL cholesterol concentration between groups showed significant correlation between case and control groups in the age groups between 41 to 50 years and 51 to 60 years, whereas the p-value found less than 0.001 and 0.002, respectively. But in the age groups more than 60 years, we didn't find any significant correlations, but the p-value was 0.515. In regression analysis between male and female participants of the case groups based on age, we found the p-value was 0.242, so there had not been any significant correlations. Conclusions. In the study, it was found that total cholesterol, LDL cholesterol, and triglyceride were significantly higher, and HDL cholesterol was significantly lower in coronary heart disease patients. This was my abstract. Now the original things. The introductions. Lipid profiles means the pattern of lipids in the blood. It contains total cholesterol, triglyceride, LDL cholesterol, and HDL cholesterol. In general, the lipid profile tests are used as indicator of whether someone is likely to have heart attack or a stroke due to the blockage of the arteries or atherosclerosis or hardening of the arteries. For a person of 68 kg, the typical total blood cholesterol synthesis is about 1 gram per day. Increased level of total cholesterol, triglyceride, and LDL cholesterol are found to be associated with higher risks of coronary heart disease and stroke. Whereas the HDL cholesterol are found to be inversely associated with the risk of coronary artery disease. Dyslipidemia is one of the primary causes of coronary artery disease. Introduction. American Heart Association guidelines prescribes desirable level of lipid profile as total cholesterol should be less than 200 mg per dl, triglyceride should be less than 200 mg per dl, HDL cholesterol in male should be more than 50 mg per dl. In case of female, it should be more than 40 mg per dl. and the LDL cholesterol should be less than 130 milligram per TL. But a patient with coronary heart disease, where the desirable level of lipid profile should be as total cholesterol should be less than 200 milligram per TL, total triglyceride should be 150 milligram per TL, HDL cholesterol in male should be more than 50 milligram per TL, and in female, it should be more than 40 milligram per TL, whereas the LDL cholesterol should be less than 100 milligram per DL. These are the desirable levels should be taken in case of coronary heart disease. In another study of American Heart Association also found that there is a higher percentage of females, about 46.8% compared to the males, 34.9%, had an optimum level of LDL cholesterol that is less than 100 milligram per TL. About 20% of male had a very high level of LDL cholesterol, whereas while it was noted in only 6.7% female of patients having these higher levels. This is because the female remains protected before the premenopausal period with the female hormones. In human body, cholesterol is important for cell membrane and synthesis of sex hormone like estrogen, progesterone, adrenal hormones like testosterone, cortisol. It also helps to synthesize vitamin D in the skin, thus helps to maintain bone density by using calcium. Many previous studies on lipid profile have been conducted in some of the famous institutions in Bangladesh. Among those institutions or hospitals, NICBD Dhaka, ICDDRB Dhaka, M.Abdur Dhaka are some of the noticeable ones. Although there had been many studies conducted on lipid profile of coronary heart disease patients in Bangladesh, there are some variations in the findings of those. For this reason, we conducted this study to acquire some more specific informations and correlations between lipid profiles and coronary heart disease patients in Bangladesh. Methods. This comparative observational study was conducted at the Department of Cardiology in M.Abdur Medical College, Dinajpur, Bangladesh, during the period from January 2019 to December 2019. Properly written consent was taken from all the participants before starting main part of the investigations. Initial sample size was determined to be 200 participants with 100 cases and 100 control patients. Due to some of the time constraint, inclusion and exclusion criteria of this study, the willingness of the patients to participate in the study, a total of 131 participants were finalized as the study populations. Among them, the case group was formed using 90 patients who had coronary heart disease, and the control group was formed with 41 healthy people. Convenient sampling method was used for the selection of the participants. The age of the participants was 41 years and above. All the demographic and risk factors related informations were collected from the available patients, records available in the hospital, and by a data collection sheets provided to the participants containing the important information of the patients. The patients of the case group, the number 90, were selected with a history of angina and or surviving myocardial infarction with or without diabetes mellitus and hypertension, admitted and diagnosed in the coronary care unit of mentioned hospital. According to the exclusion criteria of the study, coronary heart disease cases with liver disease, renal disease, and thyroid disorders were excluded. Whereas clinically healthy subjects aged about 41 years who served as population-based control were selected as the participant of the control group. Estimation of lipid profile, that is total cholesterol, triglyceride, LDL cholesterol, and HDL cholesterol, were done in both the case group and the control group. All the necessary data were collected, analyzed, and disseminated by several programs of MS Office and SPSS version 23. The math continue. The inclusion criteria which we considered the case group. The case group was the age 41 years and above. Patients were with history of angina or myocardial infarction. The patient admitted at the CCU of that mission hospital in the study group. Control group was selected like that. The aged more than 41 years and above, willing to participate in the study. Clinically, they are healthy subjects and willing to share the necessary informations. Here's the exclusion criteria of the case group. The case group was less than 41 years of age. They were excluded. Patients with liver disease, renal disease, and thyroid disorders, they were excluded. And mentally unstable patients were not included in the case study. In the control group, they were less than 41 years of age, mentally unstable, clinically unhealthy, and unwilling to share the necessary information. Those groups are excluded. Results. The study was conducted with 90 case group participants and 41 control group participants. Among the case group, 70 were male, which was 78%, and 20 were female, which was 22%. Among the male participants of the case group, 44.29%, 37.71%, and the rest 20% were from 51 to 60, 41 to 50, and more than 60 years age group respectively. Here, the middle is that is 51 to 60 years having the most of the case groups. On the other hand, among the female participant of case group, 45%, 30%, and rest 25% were from 51 to 60, 41 to 50, and more than 60 years age group, respectively. In regression analysis between male and female participants of case group, based on age, we found the p-value was 0.242, so there had not been any significant correlation between male and female. The study showed both serum total cholesterol, HDL cholesterol concentration were significantly high in all groups, and p-value was less than 0.001 in every age group. Triglyceride concentration was significant between case and control group in 41 to 50 years and 51 to 60 years age group with a p-value less than 0.001. But in the age group more than 60 years, we didn't find any significant correlation where the p-value was 0.478. The LDL concentration between groups showed significant correlation between case and control groups in the age groups between 41 to 50 and 51 to 60 years, whereas p-value found less than 0.001 and 0.002 respectively. But in the age group more than 60 years, we did not find significant correlation, where the p-value is 0.515. Here's the pie diagram of gender distribution of the participant in this group. The total number of cases was 90. Out of them, 70 were male and 22 were female. In the table, this is distribution among the participant of the case group. The total number of cases was 90. 41 to 50, between 41 to 50, it was 25 were male, 6 were female, total 31. And for 51 to 60, 31 were male and 9 were female, and total number 40. In more than 60 years, the male number was 14, female number was 5, and total 25. Here we see the majority patients remaining within the 51 to 60 years, the middle age group. That is male 31, 44.29%, and the female 9, that is 45%. Here is the age distribution of total cholesterol concentration between the groups. The total number of cases 131. Here the age is between the ages 41 to 50. The case number of cases was 90 and control 41. Here out of 90 cases, we found the total cholesterol level between the age of 41 to 50, it was 197, but the control having 168, and the p-value was significant. Between the age group 51 to 60, this is about 207, 207, whereas the control group having 119, and the p-value is again significant. In more than 60 years, again, the total cholesterol is 263 out of control group having 193. This is again p-value is significant. Here we see the cholesterol concentration is getting increased with the age increases, having the more preponderance of coronary heart disease. The age-wise distribution of triglyceride concentration between groups. Here we see between the age of 41 to 50 years, the triglyceride concentration was 167 in case of cases where a control group having 109. This is having the significant p-value. Between the age group 51 to 60 years, this is having triglyceride concentration 210, whereas control group having 125. And this is again the p-value is significant. But in case of more than 60 years age group, the triglyceride concentration was 152 and the control group having 157. This is having insignificant p-value. Age-wise distribution of HDL concentration between groups. Here we see the age between 41 to 50 years, where the HDL concentration was 40 in case of cases, and the control group was having 50. This is the significant p-value. Between the age group 51 to 60, this is having HDL concentration is 47, whereas the control group having 75. This again, the p-value is significant. But more than 60 years age group, the HDL concentration is again 43, and the control group was having 86. So this is p-value again significant. So here you see the HDL concentration is gradually reduced in the age groups having the case than that of the control group. The age-wise distribution of LDL concentration between the groups, here we see that between the age group 41 to 50, the LDL concentration was 99, whereas the control group 75. This is having significant p-values. Between the age group 51 to 60 years, the LDL concentration again is 104, then that of the control having 90. This is the significant p-value again. But in case of 60 years, more than 60 years, here the LDL concentration 107, whereas the control group was having 117. This is having p-value 0.515. This is insignificant. Discussion, let's see. Depending on the severity of the coronary artery narrowing, myocardial responses are divided into chest pain, acute myocardial infarction, sudden cardiac death, and chronic ischemic heart disease. The most common risk factors, coronary heart disease, are hypertension, smoking, obesity, dyslipidemia, diabetes mellitus, stress, gender, and its variations. There are also high levels of total cholesterol, triglyceride, LDL cholesterol, VLDL cholesterol, and low level of HDL cholesterol, which are considered as the most common modifiable risk factor of coronary heart disease. Egyptian and Framingham study demonstrated that elevated levels of plasma cholesterol found in the patient with coronary heart disease. Among male participants of the case group, 44.29, 35.71, and the rest 70% were from 51 to 60, 41 to 50, and more than 60 years. On the other hand, among the female participants of the case group, 45%, 30%, and rest 25% were from the 51 to 60, 41 to 50, and the more than 60% were respectively. So middle age group may be considered as the potential risk factors who are having the coronary heart disease. Atherosclerosis is not clinically evident until middle age or later when the arterial lesions participate the organ injury. This is the thing.
No, we can't hear you, Doctor.
Yeah, sorry. Incidence of myocardial infarction increases 5 times between the age ranging from 40 to 60 years. In addition, men are much prone to develop atherosclerosis than women. Myocardial infarction, coronary heart disease, atherosclerosis are uncommon in premenopausal women. It is theorized that incidence of atherosclerosis-related disease increases due to a decrease in natural estrogen level in postmenopausal period. Epidemiological studies have linked the intake of high level of dietary fat, rich in cholesterol and saturated fat, which increases in plasma cholesterol level. Therefore, restriction of saturated fat and cholesterol is the cornerstone of dietary therapy to lower down the elevated blood cholesterol level. Framingham study has demonstrated that increased level of total cholesterol, triglyceride, and LDL cholesterol, and decreased level of HDL cholesterol are independently or combinedly related to coronary heart disease or MI. In our study, age-wise distribution of both serum total cholesterol, HDL concentration were significant in all age group, and the p-value was less than 0.001 in every age group. Whereas triglyceride concentration was significant between case and control group in 41 to 50 and 51 to 60 years age group with p-value less than 0.001. But in the age group more than 60 years, we didn't find any significant correlation, and their p-value was 0.478. On the other hand, age-wise distribution of LDL cholesterol concentration between groups showed significant correlation between case and control groups in the age groups between 41 to 50 and 51 to 60 years, whereas the p-value were found less than 0.001 and 0.002, respectively. But in the age groups more than 60 years, we didn't find any significant correlations, but the p-value was 0.515. Clinical studies based on extensive literature support the inverse relationship between HDL concentration level, cholesterol level, and atherosclerosis, where its consequence, coronary heart disease and stroke. In line with these findings, our study demonstrated a significant decrease in the HDL cholesterol concentration levels in the patient with coronary heart disease when compared to the control group patients. The National Cholesterol Education Program, NCAP, recommends an LDL cholesterol concentration should be less than 100 milligram per TL in patients with established coronary heart disease and those who are coronary heart disease equivalent, mixed equivalent. Aggressive LDL cholesterol concentration reduction is associated with less atherosclerotic progression, lower rates of revascularization, and fewer ischemic events compared with the moderate LDL cholesterol reduction or conventional treatment. Conclusion. In this study, it was found that total cholesterol, triglyceride, and LDL cholesterol concentration were significantly higher in coronary heart disease patients, whereas HDL concentration were significantly lower in those patients with coronary heart disease. These findings may be helpful in the treatment arena of coronary heart disease and similar further studies. Recommendations. This was a single-centered study with a small size sample, so the findings of this study may not reflect the exact scenario of the whole country. For getting more specific information, we would like to recommend conducting more studies in several places with a large size sample. Oh, this is another scenery of my beautiful country, another scenery. Thank you all.
Thank you very much, Dr. Rezaul Alam. That is a very wonderful presentation. Dr. Rezaul Alam is from M.Abdur Rahim Medical College, Bangladesh. Thank you very much. We enjoyed the presentation.